Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, I've been managing multiple respiratory issues for a long time now: asthma, emphysema, and frequent bronchitis. It seems like I'm always recovering from one episode of pneumonia or another. This constant cycle has really been tough on me.
I understand it's been challenging for you. Can you tell me more about how these conditions are affecting your day-to-day life?
Well, my breathing is the biggest issue. Activities that used to be simple, like walking around the house or even cooking, can leave me breathless. I've had to use my Combivent inhaler more often lately, especially when the pleurisy pain kicks in. It feels like there's a weight on my chest. The pain is sharp and gets worse with every breath during a flare-up.
That sounds extremely difficult to cope with. How often do you experience these flare-ups of pleurisy?
It's unpredictable, but I would say about once or twice a month. I've started taking tramadol for the pain as you prescribed, and it helps, but I'm cautious about using it too often because it makes me quite drowsy and a bit out of it.
It's good to hear that the tramadol helps with the pain, albeit the side effects. How about your kidney health? I recall advising against NSAIDs due to your kidney function.
Yes, I've completely stopped taking any NSAIDs. It's tricky because sometimes I feel like they might help with the pain, but I remember your advice about the potential harm to my kidneys.
That's very wise of you. Managing without NSAIDs is the right choice given your kidney condition. Now, how are you managing your trips to the hospital or clinic? I remember you mentioning mobility and transportation challenges.
It's a hassle, honestly. I can't drive myself when I'm feeling weak, and arranging for transport can be a headache. I've tried to avoid going to the ER unless absolutely necessary. I've been using the azithromycin and prednisone you prescribed to manage exacerbations at home, and it's helped prevent a few hospital visits.
That's a good strategy, keeping those medications on hand for quick intervention. It's important that we keep your conditions managed as much as possible at home. How have you been feeling about your independence and daily activities?
I value my independence, but it's getting harder. I live alone, and sometimes I worry about what might happen if I have a severe episode and can't reach the phone. It's a constant concern in the back of my mind.
That's a valid concern. We might need to think about additional support for you at home. Let's review your recent test results and see where we stand. Your blood pressure and heart rate are stable, which is good. Your respiratory rate is fine at the moment, and oxygen saturation is slightly lower than we'd like, but it's expected given your emphysema.
Yes, that oxygen level has been a concern. What do the other tests show?
Your kidney function is slightly below where we'd like it to be, with a creatinine of 1.4 milligrams and BUN at 28 milligrams per ml, but it's stable. Your liver function tests are normal, which is excellent news. The bone density scan shows some osteopenia, which is something we'll keep an eye on. Your cholesterol levels are fairly controlled, which is good for your cardiovascular health.
That all sounds like a lot to manage, but I'm glad some things are stable.
Absolutely, stability in your condition is our main goal. Now, regarding your treatment plan, continuing with Combivent and Spiriva for your respiratory issues is essential. We'll keep tramadol for pleurisy pain, but use it judiciously. I want to monitor your kidney function closely given your history, and I'm scheduling another ultrasound of your aorta to ensure there's no progression of the dilation.
Thank you, doctor. I appreciate the thorough overview.
Of course. I'll also make a note to discuss a living will and advance directives with you in our next visit. It's important to have those decisions documented. Let's aim for a late morning appointment next time to fit your schedule. We'll continue monitoring your condition closely and adjust as necessary. I'm here to support you through this.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, thanks for seeing me today. I wanted to discuss a few things that have been concerning me lately. First off, the pain. It's been really tough to manage. I've had chronic back pain for years due to my scoliosis and past spinal surgeries. I've been on Norco for a while, but I think it's making my constipation worse. I heard about tramadol as a possible alternative. What do you think?
Thank you for sharing that with me. We can definitely explore alternatives like tramadol, which may have a lower risk of constipation and dependence. We'll address that in more detail shortly. Tell me more about how your pain and other symptoms are affecting your day-to-day activities.
Well, the pain can be pretty debilitating. Some days, it's hard to get out of bed. I use my cane and walker to move around, but even then, it's a struggle. The pain also seems to worsen in cold weather or when it rains. On top of that, I've been struggling with my bowel movements because of the pain meds. I've been using enemas more frequently than I'd like.
That sounds challenging. Managing your pain while avoiding further complications like constipation is important. Adding Miralax to help with your bowel movements might be beneficial. Now, you mentioned a chronic cough with phlegm, especially at night. Can you elaborate on that?
Yes, every winter it seems to get worse. I cough up a lot of phlegm, and it disrupts my sleep. I've been smoking for a long time, which I know doesn't help. I've cut down to about 2 to 3 cigarettes a day, and I'm trying to quit entirely. I've tried lozenges before, but they didn't suit me well.
Quitting smoking is a crucial step, especially with your respiratory symptoms. Nicotine gum could be a viable option for you. We'll also schedule pulmonary function tests to better understand your lung health given your symptoms and smoking history.
That sounds good. I also have this numbness and weakness in my left hand and arm ever since my neck surgery. It hasn't improved much over the years. And then there's the spasticity in my legs. The Botox injections help a bit, but it's still an issue.
Managing neurological symptoms like yours can be complex, especially with your history of spinal issues and surgeries. Continuing Botox for spasticity is a part of our strategy, and we need to keep monitoring your hand and arm symptoms closely.
I appreciate that. I also want to mention that I drink a few beers every day. I don't know if that's affecting any of my symptoms or my medications.
Alcohol can indeed interact with your medications and can contribute to liver stress, though your liver function tests are currently within normal ranges. It's something to keep an eye on, especially with your ongoing treatments and medications.
Okay, I'll try to cut down on that too. Thanks for helping me figure all this out.
Of course. Here's what we'll do moving forward. For your pain, we'll try switching from Norco to Tramadol and see if that helps with both pain and constipation. I'll prescribe Miralax to help regulate your bowel movements more comfortably. For the respiratory issues, we'll get those pulmonary function tests done and a repeat chest x-ray to ensure there are no significant changes since your last one. We'll also try the nicotine gum to support your efforts in quitting smoking. We should follow up in about 4 months to assess how these changes are working for you and to discuss any adjustments needed.
That sounds like a good plan. I'm hoping these changes make a difference. Thanks for taking the time to go through everything with me.
You're welcome. It's important that we work together to manage these issues so you can have better quality of life. I'll see you in 4 months, but don't hesitate to contact the office if you have any concerns before then.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
We've seen a significant increase in ankle injuries with the recent marathon. Have you noticed any trends in the treatments being applied?
Yes, I've observed that early physiotherapy intervention post-injury seems to reduce recovery time significantly. Should we consider setting up a dedicated clinic?
That sounds like a good strategy. Early physio can indeed help. Maybe we can collaborate with local sports clubs to provide on-site assessments during events.
That would be proactive, plus we could use it as an opportunity to educate athletes on injury prevention.
Let's draft a proposal for the Sports Council. I think it could really benefit the community and reduce long-term complications.
Now look at question 26.
Dr. Simmons, the increase in respiratory issues among children in our area is concerning. Have there been any environmental changes that could be causing this?
Yes, there's been an increase in pollution levels reported. It's affecting air quality, especially on hot days, which might explain the rise in asthma cases.
Should we organize an asthma education session for parents? Maybe include some tips on how to manage symptoms at home.
That's a great idea. We can also discuss preventive measures to minimize exposure to pollutants. Let's include practical demonstrations on using inhalers and nebulizers.
I'll coordinate with the community center to set a date and start promoting the session.
Excellent. Keeping the community informed is key to managing these environmental health issues effectively.
Now look at question 27.
Have we received the latest lab results for the patient with suspected Lyme disease in room 208?
Yes, the ELISA test came back positive. We need to start her on doxycycline as soon as possible.
How is she feeling? Any improvement in her symptoms since admission?
She's still experiencing joint pain and fatigue. I've informed her about the treatment plan and the importance of completing the antibiotic course.
Good. Make sure she knows to come back for a follow-up. Lyme disease symptoms can persist, and she might need further treatment.
Will do. I'll also arrange for her to speak with a specialist about long-term management.
Now look at question 28.
There's been a rise in reports of hypertension among our patients aged 30 to 40. It's unusual for this age group. Any thoughts on the cause?
Stress could be a significant factor. The economic downturn has affected a lot of people. Perhaps we should start offering stress management workshops.
That's a great idea. Managing stress can certainly help with blood pressure control. We could integrate mindfulness and meditation sessions.
I'll speak with the mental health team and see if we can get a program started this quarter. Early intervention could prevent more serious health issues down the line.
I'll help organize the logistics. Let's aim to provide these resources as soon as possible to help our community cope better.
Now look at question 29.
We're introducing a new pain management program focused on non-pharmacological therapies. It's designed to help patients with chronic pain manage their symptoms more effectively.
That sounds beneficial. What kinds of therapies are we talking about?
The program includes physical therapy, acupuncture, mindfulness techniques, and cognitive behavioral therapy. It's a holistic approach that aims to reduce dependency on medications.
How will we determine which therapy is suitable for a patient?
We'll start with a comprehensive assessment by our pain management team. Based on the patient's condition and preferences, we'll tailor a specific treatment plan.
I think this could be really impactful. Managing pain without extensive use of opioids could improve quality of life for many of our patients.
Exactly. That's the goal. We also plan to conduct workshops to educate patients about the benefits and empower them to take an active role in their treatment.
Now look at question 30.
There's been an uptick in cases of foodborne illnesses linked to the cafeteria. We need to address this.
Yes, I've heard. Do we have any data on the specific outbreaks or common symptoms?
Mostly reports of Salmonella and E. coli. Symptoms include severe stomach cramps, diarrhea, and vomiting.
We need to inspect our food handling processes and perhaps revisit our supplier agreements. Maybe it's time for a full audit.
I'll coordinate with the facilities team and set up training for all cafeteria staff on proper food safety practices.
Let's also increase monitoring and ensure that there are strict compliance checks regularly.
Absolutely. Patient and staff health must be our top priority. I'll also prepare a communication to inform everyone about the measures we're taking to resolve this issue.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Good evening, everyone. I am thrilled to share with you some of the groundbreaking work we've been conducting in our lab over the past 2 decades. This journey began as a simple inquiry into cellular mechanisms and has evolved into a promising therapeutic strategy to combat cancer, a field where innovation is critically needed. Today, I will discuss our recent developments in cancer immunotherapy, particularly focusing on a novel approach that targets cancer cells, unique sugar coatings. These developments could not have been possible without the collaborative efforts of a dedicated team and the inspiration drawn from a myriad of scholarly articles, including those from Harvard University, which have continuously propelled our scientific understanding and methodologies. About 20 years ago, during my doctoral studies, I became intrigued by the complex world of glycoscience. Sugars, as you might know, are not only essential components of our diet, but also play critical roles in cellular functions. They form a dense layer on the cell surface, known as the glycocalyx, which is pivotal for cellular recognition and communication. A landmark study published in Harvard's collection revealed subtle yet significant differences in the sugar compositions of healthy versus cancerous cells. Healthy cells typically exhibit a well-structured glycocalyx that facilitates normal cell functions, whereas cancer cells often display a disorganized and overgrown glycocalyx, contributing to their malignancy and ability to evade the immune system. To elucidate this, let's consider the case of a patient. Let's call her Jane. Jane was diagnosed with a highly aggressive form of melanoma, which presented an irregular pattern of sialic acid, a specific type of sugar, on the surface of her cancer cells. This irregularity, as research suggests, plays a crucial role in how cancer cells hide from the immune system. During my postdoctoral fellowship, inspired by these findings, I delved deeper into the mechanisms of how these sugars interact with immune cells. The immune system, typically vigilant against pathogens and abnormal cells, can be fooled by the deceptive coating of these malignant cells. In the healthy state, immune cells, such as T cells, recognize and destroy aberrant cells. However, in cancer, these cells camouflage themselves with a misleading sugar coat, making them appear harmless, thus bypassing immune surveillance. Fast forward to our recent innovations, where we have developed an antibody enzyme conjugate, a kind of molecular lawnmower. This engineered molecule specifically targets the sialic acid on cancer cells, effectively stripping them of this deceptive layer. Once this layer is removed, the immune system can recognize and destroy these previously hidden cancer cells. Jane participated in our Phase 1 clinical trial at Stanford Hospital, where she received this novel treatment. The results were promising. Her immune system began to recognize and attack the melanoma cells that were once invisible. While this is just one case, it exemplifies the potential of our new approach in providing a new lease on life to patients who have limited options. This therapeutic concept was not just a serendipitous discovery, but a result of rigorous scientific inquiry and collaboration. The implications of these findings are vast, not only in treating cancer, but potentially other diseases where cell surface sugars play a crucial role, such as autoimmune diseases and infections. Our journey from the basic understanding of cell surface sugars to a potential new cancer therapy exemplifies the power of translational research. It also highlights the importance of academic environments that foster interdisciplinary collaboration, such as Stanford, which bridges the gap between bench science and bedside application effectively. The path from understanding the basic science of cellular sugars to developing a potential life-saving therapy has been long and challenging. However, the impact of our work could be profound, offering new hope to patients like Jane and many others. It is these opportunities to make a significant difference in people's lives that drive us to push forward in our research endeavors.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Today, I want to delve into an in-depth analysis of a complex nutritional topic: the role of dietary fibers and their interaction with the gut microbiome in managing type 2 diabetes. This discussion is informed by scholarly research, including several studies from Harvard, which emphasize the multifaceted impact of fibers on health. We'll explore the physiological mechanisms at play, the clinical outcomes observed in diabetic patients, and also consider dietary recommendations based on current scientific understanding. Let's start with the basics. Dietary fibers are classified into two broad categories: soluble and insoluble. Both types play crucial roles in digestive health, but interact differently with the body. Soluble fiber, for example, dissolves in water to form a gel-like substance, slowing down the digestion process, which helps regulate blood sugar levels. Insoluble fiber, on the other hand, aids in adding bulk to stool and facilitates smoother bowel movements. The interaction between dietary fibers and the gut microbiome is particularly significant in the context of type 2 diabetes. The gut microbiome consists of trillions of bacteria that have profound impacts on metabolic health. Soluble fibers are fermented by these gut bacteria, producing short-chain fatty acids, SCFAs, like acetate, propionate, and butyrate. These SCFAs play a pivotal role in modulating blood glucose levels by influencing insulin sensitivity and metabolic functions. Research from Harvard has pointed out that a diet rich in high-fiber foods can lead to a more diverse and stable gut microbiome, which is crucial for diabetic patients. A more diverse microbiome is associated with better metabolic outcomes and reduced inflammation, which are key aspects in the management of diabetes. Now, let's discuss a case study that highlights these principles in action. The patient, whom we'll refer to as Mr. A, is a 58-year-old male diagnosed with type 2 diabetes. His initial approach to managing his diabetes was primarily through medication and moderate physical activity. However, despite these efforts, his glycemic control remained poor, and he frequently experienced postprandial glucose spikes. Mr. A was advised to integrate a diet high in specific types of fibers, particularly those found in legumes, whole grains, and certain fruits and vegetables. Over a period of 6 months, significant changes were observed. His fasting blood glucose levels improved, and his HbA1c, a measure of long-term glucose management, decreased from 7.8% to 6.9%. These improvements were accompanied by an increase in gut microbial diversity, particularly in fermentative bacteria capable of producing SCFAs. The clinical implications of these findings are substantial. For one, they underscore the importance of dietary choices in the management of type 2 diabetes. More importantly, they highlight the potential of dietary interventions as adjunct therapies in diabetes care. Instead of solely relying on medications, incorporating dietary modifications that promote a healthier gut microbiome represents a holistic approach to disease management. In terms of dietary recommendations, it is essential for patients to understand the types of fibers and their sources. Emphasizing the consumption of a variety of fiber-rich foods can help in achieving the desired health outcomes. It is also critical for healthcare providers to personalize dietary advice based on individual patient profiles, as the interaction between diet and the microbiome can vary widely among different individuals. The role of dietary fibers in managing type 2 diabetes through modulation of the gut microbiome is a vivid example of how diet can influence chronic disease outcomes. The case of Mr. A illustrates the potential benefits of dietary interventions and the need for targeted nutritional strategies in diabetes care. Moving forward, it will be important for further research to continue exploring the mechanisms behind these interactions and to refine our dietary recommendations to maximize therapeutic benefits for diabetic patients.